welcome to Path Forward, hosted by Children's Alliance, a community conversation where we will explore how to build a better future for our kids through equity-focused public policies. My name is Dan Rodland. I'm the Member Relations and Data Manager for Children's Alliance, and I'm really glad you're joining us today. Before we begin, I would like to take a moment to acknowledge that the state of Washington was made possible by the 7 treaty arrangements of tribal governments representing the people who have lived and worked and built community on this state's lands since time immemorial. We honor the native elders of the treaty tribes, the Coast Salish and Interior Salish, and all native peoples, and the Duwamish on whose ancestral lands our office is located. We are grateful for the chance to shape the laws and policies governing the children and families living here on their ancestral lands. It is my pleasure to introduce our moderator for today's event, Dr. Stephan Blanford. Stephan serves as Executive Director of Children's Alliance, where he leads a team of committed staff and volunteers, more than 7,000 members, to advocate fiercely for improved outcomes for children in Washington State. As an unapologetic advocate for racial and social justice, Stephan's work has ranged from early learning to college entrance, leading small direct service youth development agencies to multidisciplinary demonstration projects. He is a former school board director of Seattle Public Schools and was honored with the Leadership for Equity Award at the culmination of his term. In 2022, he received the Billy J. Frank Race and Social Justice Award from the Evergreen chapter of the American Society for Public Administration. Please give a warm welcome to Stephan.
Thank you, Dan. And welcome everyone to this Path Forward event. We're super excited that you're here. I circled it on my calendar, and we've been looking forward to designing an event that will talk about a serious issue. For those of you that aren't familiar with Children's Alliance, we are Washington State's nonpartisan advocacy organization. And our mission is to place racial justice at the heart of Washington's laws and budgets. Our vision is that all of Washington's 1.6 million children have all that they need to thrive and do well in their lives. We're unapologetically anti-racist in our orientation. We believe that racism is at the root of most of the disparities that we see in children's outcomes, and that we have to work tirelessly to undo that racism. We advocate with communities and not for communities, and that means that we work with community leaders and parents and those who care about kids, and we elevate their voices so that they can advocate for their own children and their own needs. As Dan mentioned, we're powered by 7,000 members all across the state of Washington who advocate with us, and we will not stop until every child has every opportunity that they deserve to thrive in their lives. We're so grateful to the many volunteers, donors, grantors, community leaders, and partners who have joined in this effort to transform Washington. And amongst those, we're very excited by the number of elected officials who've chosen to join us today. Senator Annette Cleveland, Representatives Carol Eslick, Representative Deborah Lekanoff, Representative Alicia Rule, Representative Mylene Tai, and Seattle Public Schools Vivian Song Moritz have all registered for this event. And if anyone has joined that is an elected official and I haven't recognized you, please let us know in the chat so that we can circle back around. As a former elected official, I know how important it is to get that recognition for the tireless work that you're doing. And so with that, I'd like to move into a discussion about the topic that we are here to talk about today. I can get my device to advance. And it is, we're talking today about the mental health of children, and in particular, when we began hosting these Path Forward events, we did it as a way to highlight the critical policy issues that are upcoming in the legislative session that will start in January of this year. Our work is predicated on the belief that improved outcomes come about when community partners and parents and family members, people who care about children, work along with their elected leaders and experts in the field to make good policy. And it's my pleasure to introduce two of those policymakers and experts. First, on my right is Representative Lisa Callan. She was elected in 2018. We were talking a little bit about the fact that we both served as school board directors and in a former life, but she currently serves in the state legislature representing the 5th District, and she co-chairs the Children, Youth, and Behavioral Health Work Group. And that is charged with studying the issue around behavioral health and making recommendations to the legislature. And also joining us on this panel is Dr. Trevor Greene. Dr. Greene is in his 5th year as the superintendent of Yakima Public Schools. He's uniting all of Yakima, all of that community, around an ambitious strategic plan that is focused on student achievement, on attendance, on dual language, early learning, and on-time graduation. Dr. Greene has done everything from being a para-educator to now leading one of Washington's largest school districts. And he also serves as a board member of Children's Alliance. So I want to thank you both for joining us today. And before we get into the questions, I wanted to start and ground us in the unfortunate reality here in Washington State. Some sobering statistics about the state of our youth mental health. Over half of the children in Washington State, adolescents, currently experience some anxiety or depression. And more than 20% of them register as having clinically significant levels of anxiety and depression. Multiracial children report higher levels than any other racial group, and female identifying and LGBTQ plus youth report symptoms of depression and anxiety at double the rate of their male identifying and heterosexual youth. Non-binary youth experience depression and anxiety at 6 out of 7 cases. So large numbers of children reporting high levels of depression and anxiety. So much so that the US Surgeon General, not only in our state, but in the entire country, acknowledged in an advisory on youth mental health that nationwide, far too many children are struggling with their mental health and unable to get any of the support that they need. This reality prompted Children's Alliance to convene a steering committee of key school, practitioner, academic, and state leaders to review promising local and state level initiatives that would help to address these needs. These findings are included in a report that we're making available on our website, and we'll add the link to the chat for this meeting, so you're able to access it directly if you choose to do so. And based on the number of media interviews that I've done this summer alone, I can tell you that in all parts of the state, this is an issue that is very high or top priority. I've talked to legislators, I've talked to media outlets, leaders in schools, as well as leaders in communities, and they all attest to the fact that this is, if not the #1 issue that their communities are facing, very high on the list. And so with that out of the way, I'm going to turn to the first question. Representative Callan, you serve as co-chair of the Children and Youth Behavioral Health Work Group, leading a group of hundreds of stakeholders focused on improving behavioral health services and strategies for children, youth, families, and caregivers. The group, which includes members with lived experience, helps to inform policy solutions. What are some of the ways in which this group has been helpful when it comes to developing policies related to behavioral and mental health?
The group of those with lived experience, in particular for our stakeholders with the Children Youth Behavioral Health Work Group, has been extremely beneficial. The work group itself, I think this last year in the 22 recommendations, touched over 300 people that engaged into the deeper process of the state work group. And we have 5 subgroups, and across all of that, we have 2 that in particularly we dive in deeper with youth. And the youth and young adult continuum of care services group, we call it the YAC group, and they have YACs as their mascot. It's real fun. Has a youth lead and co-lead that's connected to that work, and try to have separate groups specifically targeted for youth access, because for us, we're doing these meetings during the day, we're doing during the regular business day, and youth are in school or they're, they cannot connect and be engaged and involved. So we want to make sure we're bringing those voices. But in particular, one of the other efforts that's going on with the Children and Youth Behavioral Health Work Group is a strategic planning initiative, and wanting to make sure we're connecting with those families and youth that are engaged with the system and have been engaged with the system. And if you get an opportunity to go to TVW, which is everybody's favorite TV show, right? To just watch one of the Children and Youth Behavioral Health Work Group activities or one of the subgroups, then you'll have an opportunity to see the lived experience voice and how it comes through. We can have policy recommendations every day, but until you understand how it shows up and a person is actually experiencing it, and how they feel and see the system, you'll never be able to have a true implementation or a direction that's going to be viable and create the outcomes that we want. And that has shown itself when we really put in a robust process that allows those voices to be heard and brought forward in the table and given equal power, or plenty of space to express the concerns. And then that is part of how we meld and mold and bring the recommendations forward in the work group.
Nice, nice. Very much aligned with our ideas about elevating the voices of people who are going to be most impacted by the laws, so they get to have input into the creation of those laws and policies. So that's nice. Thank you. Do we have Superintendent Greene? I thought I heard you.
Oh, can you hear me now?
We can hear you. Great.
All right, wonderful.
I'll ask you that question again, because I imagine you might have, in trying to get reorganized here, you may have missed a bit of it. As a school administrator, you and your staff are at the front lines of this crisis. And I remember when you and I had a conversation back in 2021 about this issue. And so we're curious about what's been the trajectory. Have things gotten better, or have they gotten worse since 2021?
Well, thank you. And first and foremost, I appreciate being invited here to give a perspective from school districts. We have 295 school districts in the state of Washington. So to be representative of them in some capacity is not something that I take lightly. And thank you to all of those who are in attendance today, because there is nothing greater than giving the gift of time. Before responding to your question, I also do want to recognize that the Yakima School District also rests on the lands of Native people. We are on the ancestral lands of the 14 Confederated tribes and bands of the Yakima Nation, which once inhabited 12 million acres in the central Washington area. That's important specifically to me as a Native American from the Muskogee Creek tribe and growing up here in the Yakima area on the reservation, to recognize our indigenous people here and their contributions. Now, to answer your question, to respond to what has happened or has happened in our state as far as recognition of the needs of our students, we have seen a tremendous increase and I guess I don't know if it's the increase or actually we're much better at identifying when there are issues of mental health that are happening. So the question, I believe, was from 2020 or 2021 on. And of course, coming back from the pandemic, it created a unique challenge, because then mental health was placed at the forefront. We were, as educators, in the homes of individuals in the virtual setting, and you could see the students that were living their lives under their current context, which is something that we we're very skilled at not recognizing, I believe, in public education. We like to say that we knew what our students were experiencing, but truly we did not. And we've gotten much, as I said, we've become much more accomplished at that over the course of time. In looking at some of the numbers of which I'm aware, just alone in the last 2 years, if we take 2021 to 2023, we've recognized in the Yakima area that we have a significant problem around mental health issues. And I think in responding, one of the things that I think people recognize in this area is the challenge of, and let's just put it out there. I mean, there's a lot of gang activity, a lot of activities in our community that is something that creates a challenge that enters into the school. In conjunction with our police department, we've recognized that domestic abuse is a determining factor in the area of gang violence. You'll be hard pressed to find somebody that is in a gang that has not experienced domestic violence at home. And when you're talking about domestic violence, then that does contribute to mental health issues of the family and of certainly children. So when we're talking about mental health, we have to look at what the root cause may be in many cases. And I think that's an ongoing challenge for districts to determine. In Yakima, we are taking that seriously, that opportunity. And with our police department, we now identify any student that has a police action that takes place in their home in our community. If you have the police show up in your community by 6:15 the next morning, our safety and security director is notified, and we have a system in place to notify then the principal, the counselors, and the teachers that there was some type of action that could result in an adverse behavior that could affect mental health of the individual and certainly behavioral responses during the course of the day. So over the last, and I referenced the last 2 years, if I look at the elementary level, when we started this program 2 years ago, we had over the course of the year 400, just over 400 incidents that occurred in our community at the elementary level. Last year, we were at 586. So you saw a tremendous increase from 405 at the elementary level to 586. And I also believe that that's because we're also becoming much more proficient at identifying those issues and engaging as a community, not just the police department and the Yakima School District, but then putting together a coalition to provide outside agencies that can certainly support in that endeavor. At the high school level, we've gone from 297 to 500 in 1 year identified actions at the home that then can affect and impact behavioral responses from the student. And I should also then share with you that our teachers do not, and our counselors and our administrators do not pull kids out of class, do not flag that in an overt manner. It's simply so that we can keep our eye on our children and make sure that when we see potential changes in behavior, that we are much more acceptable and prone to differentiate the way that we react as adults versus our expectation to have a student change behavior when they're going through a challenge that we wouldn't have been aware of otherwise. So that's an example of one of the indicators that we've seen that shows a tremendous increase, and we're already on pace to exceed the last 2 years in incidents that require police action and then do result in potential behavioral actions by a student at the elementary, middle school, or high school level.
Got it. And what I hear and how you responded was that we've gotten better at identifying the sources of the problem, not that it's going up or down necessarily, but that we have better tools to identify where behavioral health problems exist.
Well, my belief is that it has increased, that we are seeing an increase in mental health issues that are there. But as far as quantifying them for you, I'm not sure that I can do that, other than I can tell you that we engage tremendously in building an opportunity for our students to engage in student voice and having them recognize the issues that they bring to the forefront. We have student voice circles at our elementary schools, and we have a superintendent student advisory council that comes together, and that's around 40 to 60 secondary schools that meet on a regular basis. And over the last year, they did identify as one of the predominant area of concern was that of mental health. So when we listen to our students, and if we're taking that as an indicator, which we should, then it is the number one issue. And our students came together and worked with our school board to have a student, actually a mental health week identified for our district, in which we focus from and this is coming again from students, and they put this together so that we can come together as a district, not just in kind of a targeted fashion around bringing awareness to the needs of students in our district, but we do concentrate on addressing that throughout the year, but we flag that now during a specific year week in the spring for our students.
Thank you for that. I'm going to ask a follow-up question to you before I come back to you, Representative Callan. One of the findings in the report said that there are a tremendous number of kids who don't recognize that they have behavioral health issues, that they would not even recognize that that is the case, or they come from communities where taught to just be tough rather than seeking out support from communities. Is that stigma that is attached to pursuit of some sort of behavioral health counseling, is that something that you observe in your community?
The information that you're sharing is not surprising in any capacity. We are, I think it's the saying. What does the saying go? That a fish would be the last creature to identify water, because they're actually in that 24/7, right? And I think when you have behavioral health issues, oftentimes you can be the last person to know, and it does require the conditions then to make it safe and acceptable to share that with the right personnel. And for us, it is in going back to creating that student voice and putting the individuals there in a position to share their reality and acknowledge that reality from where they are. That then provides the conditions for us to put in supports that we currently have in existence, or co-design those supports in a way that meet the needs of our community. I think when we first met, I shared an African saying, and I appreciate you calling out to me at the time. You're like, Trevor, you need to get more specific about where that came from. And I haven't been able to loop back to you over the course of several years. I see you smiling right now. And it's the Iwimina tribe out of Africa that made the statement, if you want to go fast, go alone. If you want to go far, go together. And we have to go farther than we are currently. And that requires a collective effort in creating the conditions then for a community to provide those supports necessary of safety, of vulnerability, but then of the actual programs and coordination of services that can then result in a way for our students to receive the help that they need. And it extends out into our entire community. Our students are not going to be of good, sound mental health if the families are hurting. In education, I like the saying that if the principals are hungry, they eat the teachers. If the teachers are hungry, they eat the students, right? And so we have to make sure that mental health is going up the chain, so to speak, whether it be at the home or in the community or in the school system itself.
Let's not have anybody eating anybody else today.
That's right.
That's right. So Rep. Callan, I want to give you the opportunity to share more about what your work groups are coming up with and what would be valuable for our audience to know.
Well, I appreciate that. And I definitely want to, again, thank, as Dr. Greene modeled so well, our gratitude and thanks for being able to share this message and the work that the Children's Alliance does in pulling and convening these kinds of conversations, so we can connect the dots, and then the deep work that you've done in your report. And huge kudos to our school districts, the 295, plus actually out there that are doing the deep work that Dr. Greene is talking about, some with very different levels of resources of what's out there and what that looks like. And so that statewide landscape is part of what we're trying to show and understand and work through at the statewide Children Youth Behavioral Health Work Group. So, you mentioned the question or the comment about students not necessarily even knowing that they are in a high anxiety state, right?
Or there being a stigma attached to
There being a
seeking
stigma
care.
attached to that, whatever, or that, yeah, the barriers, what we would call a barrier may not even be recognized as a barrier. So I think the multi-tiered levels of system support that the school districts are trying to pull together and to build the connection of services and supports between what they can do within a school district, what they can do through the education service districts, through the community providers, through our local and statewide governments. You know, it all, there's a deep connection to funding, there's a deep connection to workforce development and pipeline to be able to provide these resources. And then connecting that also to our federal government and the pathways that they're providing for us to do better and need to do better, right? And in light of barriers that exist for our state, both at the federal level and at the state level, how can we build out infrastructure that creates better outcomes for all of our kids? And so that's part of where we sit with the Children Youth Behavioral Health Work Group. And there's 5 subgroups plus an advisory council that's working specifically on the strategic plan that serve on the Children Youth Behavioral Health Work Group. So there's a perinatal through age 5, which is kind of the early learning and early engagement and relational health aspects of our children. There is a behavioral health integration subgroup that is focused on working on how we can better provide primary care services in behavioral health environments, and the other, how we can provide behavioral health services in a primary care environment. So if you're going to your pediatrician's office for a well check, what is it that we can do to provide an instant kind of acknowledgement of what that stomach ache is actually about anxiety, and that anxiety can then be supported by somebody within the office where you're comfortable, where you're already showing up to try to help that child and make that connection, right? So there's that subgroup. And then there's the youth and young adult, which is really the adolescents through transitioning youth into adulthood. So it goes through age 25. And then the school-based subgroup, which is really focused on how we can improve behavioral health in our K-12 system and connect that to our early learning system, what that looks like. And then there's a group that's specifically focused on workforce and rates. And what does that look like? How do we build the pipeline? How do we make sure we can sustain our existing services and promote and incentivize people to be in the work in our community so that we have the resources we need to have the skill sets where and when they're needed to be able to develop that. The work group is going to be wrapping up its work for this next year's legislative session, and report to the governor is due the first week in November. And each subgroup will bring forward the recommendations to the work group body and membership themselves to vote on. And there's going to be over 20 recommendations, likely for there to be a conversation and a deep conversation about what is in this moment of time where we're trying to build out the system capacity, build out workforce, but also meet and stabilize the crisis that we have in our state right now, and making sure there's crisis services and supports that are available, making sure that we're not just shifting the pain from one spot to another. And so the 20th of this month, you can join again on TVW and watch those recommendations be presented, brought forward, and discussion. And then on the, I believe it's the 23rd, following Monday, there'll be a work group vote to prioritize those recommendations. And then all of that will go into a report to the governor's office for hopefully inclusion of those items into the governor's budget. And then, of course, a lot of legislative champions that are involved and engaged in this process. And so we try to move that agenda that's coming out from all of our stakeholders, which you all have been engaged in and a part of in your recommendation and your reports, to try to bring that forward in the legislative session to move the dial and what we're doing to go forward. It takes every bit of all of us to do this work. So the state legislature really needs to step up and move the dial and make a difference on how we can show up for our communities, how we can show up for our families and our children, not only those that are in crisis, but in ways that we can prevent the crisis, and the ways that we can let our school districts, focus in on helping our students do the learning to allow them to, become their best selves and their best futures, and do more that we can to help each child be ready to learn. And so it really is going to take local support, community support, our school districts, and engaging on that. And so some of the recommendations coming out are going to span all of that, within including keeping existing funding that's in place. Right. How do we actually do that? There was significant investments that came through to our school districts through COVID relief funds that are one-time money, that are short-term money, that we've been trying to build out this infrastructure and meet that demand. So we want to, from my perspective, I'm a pro and absolutely advocating for, with my colleagues, to make sure that we don't lose ground in this space, and making sure that we can do what we can do to stabilize as well as add resources in. I could go on all day. So
I think, as you were talking, one of the key findings of our report, which I think goes counter to what some might believe, is that this isn't a Puget Sound problem or a Seattle-based problem. I remember the statistic that said that there's only 3 percentage points from any part of the state as far as the incidence of behavioral health challenges. That means that in every part of the state, there are high levels of kids that are responding to these crises and asking for help. I came into it with some belief, I don't know why I would have this, but some belief that it might be more of an urban problem than it is a rural problem. But in our report, it says it's a statewide problem. And in particular, in different parts of the state where there's limited access to providers, it's exacerbated because you can't find support.
Exactly. Right? Yeah, exactly. So we have deserts all across our state, and the need is absolutely there. The root causes and what's sitting at that might vary, right? So you heard Dr. Greene talk about domestic violence and gang affiliation to that, what that looks like and means. So that might be an issue that's really highlighting or showing itself in the Yakima area. It might be a different thing if you're looking at OMAC. It might be a different thing if you're looking at Vancouver, or across the state, and what that might look like. But the data is very clear that you showed in your report, and that we're seeing in our data as well, about the anxiety and the depression and what that looks like and how it's showing itself across the way. So one of the things that the work group does, and certainly with all of our partners that are here on this call and with you, are looking at how do we better deliver more service, and at all tiers, all those multi-tiers, right? Where you're talking about promotion, how do we make sure that kids actually learn how to self-identify when they're anxious, and they know where and who they can go get support and help for? How do we help school districts and community providers that are making connections to, as Dr. Greene had mentioned, to a police involvement in a family, and making sure that there's a best practice that's connected to that to actually bring supportive services, right? What does that look like and mean? So, I mean, I think that's, these are the telehealth. What does that look like to help build our, right? And how does that look like? Supervision supports for the right, how do we expand our significantly under-resourced workforce to be able to provide more, to stabilize where we are while we're continuing to grow the workforce?
And another finding that came from the report was the mismatch between the diversity of the school population, or the young people in Washington State, and the homogeneity of the workforce.
Yes.
And particularly on issues where you're dealing with identity development, you need to have some connection to the person that's sitting across the table from you.
Absolutely.
In order for the therapy to actually take effect. Is there any real discussion about that?
There is, and in fact, I think that you'll see a recommendation that's going to be presented in the Children with Behavioral Health Work Group, and that has had funding and support in the past, and will be continuing to work for, that University of Washington is working on, which is around building out and understanding what, how do we diversify the workforce, but how do we deliver culturally responsive and community engaged and connected evidence-based practice around behavioral health.
Mhm.
And how do we do that, from my perspective, not just in community and in provider, but also in our school environments? And what does that mean, right? If you're hearing, you talk about the stigma, right? Every family has their own thoughts of how and what behavioral health means to them and what that looks like. And if we can't figure out how to talk that language, we're not going to break down the barrier to get them the service. And so we have to do better at that work. And so there's some deep engagement about how we do that, even within the very homogenized existing workforce. How do we break that barrier and start there? So I'm excited about that work. And of course, we absolutely have to do so much more.
Yeah. Dr. Greene, do you have any thoughts about that?
I have lots of thoughts, and I think that what you're flagging is that this issue is not able to be pigeonholed into one area. When you start talking about all of the different factors that are out there, it's what is the actual root cause, and it may be different according to region or individual or even community. I have my questions about that, but be that as it may, it's a reality that we do have to adapt and make sure that we're not having a one-size-fits-all solution when the root cause can be very, very distinct for the individual.
Yeah. I should thank Isis Garcia, Mary O'Brien, Sherry Smith, and Maiko Ramirez for asking that question. And I'm going to quickly go to another question that was asked by Dawn Rains from Treehouse, a really dear partner of Children's Alliance. She asked, is there a path to using Medicaid funding for school-based mental health?
Yes, I'm hopeful, and it's just moving way slower than I would like. I think if you talk to my state agency partners, they're tired of hearing from me about this issue. But there's been new guidance recently, that has been put out by the Center for Medicaid and Medicare Services, CMS, we call it, that has opened up the door for more Medicaid funding for our schools. Now, the way Washington State does it, it's very inaccessible for our school districts. They have to use a third-party biller. They have to either become Medicaid billers themselves, and then you're actually able to bill based off of encounter rates, which means I saw a student on a behavioral health thing. It's just like a doctor's office, so I'm going to charge this code. That's not the way school districts work, right? They have to hire full-time staff. They don't have a funding model that supports that. The administrative any administrative cost that's above and beyond what the reimbursement will bring comes right out of dollars from the classroom, or their ability to hire the qualified staff to do the services. So we have to figure out a way to expand that. And some of the language, when I've been meeting with my federal partners on this and having a conversation, was to open up the door and try to create more access to the Medicaid dollars that would be connected to like the tier 1, what we call the promotion and the teaching and the well-being, right, in the classroom, which would be great. If you could have a social emotional teacher, if you could have the health teacher who's teaching the behavioral health well-being curriculum actually being funded through some Medicaid dollars into our school districts, which is reaching every child, the over 1 million students in our state, right? That helps us create more funding into our schools with existing workforce that helps us use some of those other dollars towards these additional needs that we have to build and bring, right? The problem is, and I'm like, great, this is so exciting. When do we get to start? And the way it actually can be bridged and implemented in our school district models is just, it's just not there. You ask the questions of the Health and Human Services in the federal level, and they're like, oh, we got to get back to you on how we bridge this gap and how do we do this, do that. So the healthcare authority is working on it. They're building a team to try to navigate how they can build that out with educators at the table to try to figure out how we can move this. But it's not something, I was hoping I could do something this next legislative session, right, to get something moving in what we could do. Yeah, but I think the journey is going to be a lot longer than that, but everything I can do to help push that along certainly will. And I don't know, Dr. Greene, if your district is a Medicaid biller, if you're using a third party and how that works for you all, if you've experienced that, but it is a key to getting more dollars into our school systems that we absolutely need.
Did you have a thought on that, Dr. Greene?
Certainly, I appreciate the question, and it moves me to think about the actual boots on the ground, the impact of having, social workers, psychologists, counselors, um, even staff providing, safety and security for our students, because that factors in, as does, parental involvement coordinators. And, you can talk about the Medicaid funding, but the reality of our state situation, and I smile because I was talking about root causes, and that has come up earlier. Just even thinking about our littlest learners coming into our system, if we can get the legislature to understand and continue to fund, and I know there was a lot of conversation around transitional kinder, for example. Now in the Yakima School District, we have over 1,200 students, according to a Bezos Foundation study of preschool age children that don't have access to services coming into our system. So you're talking about an area of great need here in the Yakima proper community versus the surrounding more suburban areas that have a much different demographic outcome, as students enter their system. So for example, if we talk about students coming into our system at the level of kindergarten readiness, according to the Walk Kids indicator, in the 6 categories, we have anywhere between, over the last 8 years, around 16% to 29% of students coming in ready in those 6 areas. One of those areas is the social emotional area, and where are those kids starting out? Where are those children starting out in the system, and would they benefit from being able to partake of a transitional kinder program where they enter earlier and they have those needs, effectively elongating that kinder experience to be able to address those needs. Currently, we have 64.4% of our students coming in prepared in that social emotional range, as indicated by the state. So you can see that we have a gap of about 35% of students starting off with challenges in that area. And then in addition, when you're talking about the Medicare funding, I also then think about RCW 28A 150-265, which talks about the prototypical school funding model. And when you're looking at, like, for example, social workers, or let's take a psychologist, for example, a psychologist at the elementary level is only funded at 0.104. That's it. So how many, you would have to have a school of over 100,000 students to effectively fund one school psychologist. And we say that we are fully funded. Well, we are not fully funded. We are fully funded according to what has been established at the state level as this, air quote, fully funded model. I can turn to special education, which is funded locally. In the Yakima School District, or in the Yakima County, we have the lowest voter turnout in the state. And right now, we spend upwards of 39.5+ million on special education services for our students, which impact also when you're talking about mental health. And we're only funded at 29 million. So there's a gap of 10 million for our community to make up. And we're talking about a community that is not in the mode of passing per se bonds, but it's more challenging with levies. This does come through levy funding. So at a time where assessed value has increased significantly across our state in an area of extreme poverty, and in a county where we don't have high voter turnout, that's also an impact then for the services that we can provide for mental health.
Yeah. In spite of all of that, you're still doing great things for kids. But kids don't come to school without their families. And what are you doing to involve families in parent education or parent leadership?
So it goes back to priorities and then ability to fund positions. Currently in our district, we do have parent involvement coordinators, and we have at the district level supervisors that are steeped in the work of Annie Shimaru out of the University of Washington. You may know her work, Just Schools, when we talk about equity. So it's about making sure that we are she talks about co-design, but it's even at that co-identification of what the true issues are. and then being able to co-design with families solutions to those issues. I think in public education, we're very good at having a laundry list of items that we believe are issues that our community needs to address without necessarily involving the community in that co-identification. So that's a move that we're making as a district, is invest in those areas where we can draw more of our community in. And it's been very powerful to see parent advisory groups that come together, or councils that come together and have events of 300 to 500 students in our schools of high poverty or Title I status. So I think there's a misnomer of not having the parent involvement. We do have parent involvement and engagement, but we do that around what the parents have identified as their needs. And they do have to do with serving students in mental health areas and making sure that services are provided for them. Because, you know, you talked about having students come in and families send their students to us. We do not take it lightly that we receive from every family their greatest treasure or treasures every single day when they send their children to us. And it has to do with not just the academic, which is our primary focus, but making sure the conditions are there around safety and security and Maslow's hierarchy of needs, making sure that there's food in their tummies and that we have services that provide breakfast after the bell and free lunch and breakfast across our entire system, so that those students can come in and have that most basic need met and then be able to focus on the academic.
Yeah. I think this question is probably for you, Representative Callan, and it comes from one of our attendees, Ryan Smith. And I should preface by saying that we survey our members, our 7,000 members, on an annual basis to understand what are the issues that are most important to them. Mental health was very high on the list. We were a bit surprised to discover that juvenile justice is also high on that list. And so this question is, how can we as prosecutors or the juvenile justice system help in addressing the youth mental health crisis?
It's an excellent question and a partnership that we absolutely have to have. I serve on not only the K-12 committee, but I also serve on the Human Services Early Learning Committee, which is the committee that is over the juvenile justice environment and policy. And I do quite a bit of work extensively on institutional education, or how we're delivering our K-12 education into and with youth that have that are involved with the justice system. And we have a dismal failure rate with our youth that have been incarcerated. We have, you know, anywhere from depending on the statistics that you see, anywhere from a 14 to 17% graduation rate. And the large percentage of our youth that are of color, a large percentage of the youth are those that have been have come in contact with, one way or another, with the foster care system. And so when you put those two pieces together, the juvenile justice system and the foster care system, which are state run, and we have that kind of graduation rate because we also have an education that is their right to have and our constitutional duty to deliver, we have failure, you know, full broad failure on what we're doing. So I think we have to do exactly what we've been talking about just with Dr. Greene and the school districts. We have to do that in our environment with our courts. We have to do that in environment with the places that our youth are connecting to and touching and spending time in the juvenile justice system. And we have to make sure we're getting down into and understanding the root of who they are and what's the best next step to give them their best chance to succeed. And that education has got to be connected to that work. If you're just doing the sentencing, or say there's a substance use issue, you can go through and you can get the healthcare and the well-being connected to that, but you also have to make sure that there's a pathway to education that gets them that happening. Right. And when you're in a long-term rehabilitation center as a youth and you're spending time, there's the operations of the facility, and then there's the education, which is done by somebody else. Mm-hmm. That operation of that facility sometimes conflicts with the ability to deliver education, right? So we have to make sure those things are connected, and we're trying and doing that. And if we get our courts thinking about and how we can better partner and support the diversion and the action around changing the narrative on meeting the needs on behavioral health and education, then we're going to start to see the upstream ability to get better education outcomes, I think, and giving those children the best chance to succeed. But we have to listen to our youth in that environment. They have to have a voice at the table, because what we think they need from a correctional perspective, or what we think we want to force in, isn't going to get them ready to learn if that's not the way the world is showing up to them in their head, in their doorstep. So how do we marry those two together and make that happen? So super excited to have that conversation. Thank you for Ryan to answer that question, and looking forward to diving into some of that.
Yeah. I was looking at the time, and we have rapidly gone through almost an hour. And we started off with some pretty dire statistics about how big this problem is. So I'm going to ask both of you, what gives you hope when you hear information about lack of funding and staffing challenges and all the rest, and you know the scope of the problem? I'm wondering, Dr. Greene, if you would start, what gives you hope? Oops.
Dr. Greene is muted on his end.
Are you muted on your end?
I see
All right, we'll go
mute
to-
button on your
We'll
video.
start with Rep. Callan.
How about now? How about now?
There you go.
You
There you
go.
Not sure how that's happening. I would, your question again was, what gives me hope? And I think when we talk about public education, we're in the human capital business. So we have 85 to 90% of our operating budget go into people. So that it stands to reason that people are what give me hope. We talk about the three most important things in education being people, people, and people. And we have a population that really now, after going through the pandemic and then seeing what's happening in the home, we can't forget that, and we have to continue to work regardless of what the exterior barriers or guardrails are in place, because that's the reality that we work with and in is our reality. And otherwise, it just becomes an excuse not to meet the needs of our students. So I take great hope in our educators, in our teachers, in our paraeducators, in our school psychologists, in our counselors, and the tremendous work that they do. And it is certainly an enormous hill to climb, and it is an exhausting, challenging profession across the board when you're trying to provide services in an area where we really are an educational institution first and foremost academically. We don't have the measures around mental health and those outcomes. So then it stands to reason that we're not going to focus as much on that as a state. So I think the best way is to change and make that a focus from the state level, to then motivate in a way that we see more of those resources potentially going to those services. But what does give me hope are our educators, and then the conversations that I do have with students that have had their needs met, and that are pulling up a seat at the table when they don't have one, right? Because there truly is no such thing as the voiceless. There are only those who are conveniently ignored or intentionally unheard. And we know that those voices are out there, and we have to, as those in power, so to speak, make sure that we prioritize those and then listen and implement around that co-design model.
Excellent. And you, Rep. Callan?
I certainly agree with Dr. Greene that people are at the root of all the hope, no doubt about it. And I think because we've been able to talk about the numbers and share, and people are feeling in their homes, they're feeling in the school, the pain around the behavioral health. Our hospital systems, our healthcare systems, our before and after school care programs, everybody, all these different sectors are asking how and what's our role to help solve this problem, and how do we meet the needs that are out there so that we can get each and every child their best chance to succeed. And so you just heard a question coming from prosecutors. We had a conversation about what we can do with our community partners before and after school programs. We're talking with our healthcare professionals, whether it's our hospitals, with our police departments. We're talking with our even, fire and EMS. We're talking with our school districts and our ESDs and all of these different sectors, no matter where you are and what you're doing, want to understand how and are starting to really truly get at the core of their gut what is fundamental to everybody's ability to meet the outcomes that we want for our children and for all of our families and for Washingtonians, because behavioral health is fundamentally connected to their ability to do that.
That's right.
Just like childcare is, just like so many, other fundamental aspects of where we are. So, I mean, Dr. Greene talked about Maslow's hierarchy of needs. This is right there. Behavioral health is healthcare, and it is the part of eating, having enough food on the table, having housing, and making sure you have the healthcare that you need when and where you need it. And because we have this moment that is, to your point, you and your surveys and your members, right? This was bubbling up to the very top. We have a moment in time that gives me hope for us to continue the great work that we've been doing, but making sure we're doing it across all sectors, making sure we're doing it in a way that we're really using a systems thinking, so we're not throwing spaghetti on the wall and causing more destruction and more chaos, but we're actually figuring out a way to stop the crisis from happening to begin with, support those midstream, and then making sure that our crisis systems have the resources they need to get where they need to go. And so it's all about the people. It's all about the hope and passion. And each and every one of you that are on this, engaged in this webinar, the deep work that you're doing as an alliance and putting your time and resources into that. Our school districts and our school district leaders, like Dr. Greene, they're working their darndest to figure out how they meet their academic needs and realize that students have to be ready to learn, and they can't do that unless they're providing all these other resources. So that is that's the hope. That's the hope for the future, and that's why I lead the Children and Youth Behavioral Health Work Group, and I cannot be more grateful for each and every one of you all that are engaged in this work every day, because you're truly saving lives.
Well, we are very grateful for your leadership, both you and Dr. Greene. As we were designing this program, I was thinking to myself, these are two people who are at the center of Washington State's response to the crisis of mental health. And so I'm so grateful that you were willing to spend some time with us. We hope you'll consider Children's Alliance and our 7,000 members across the state as essential partners in this work. We look forward to working with you during the legislative session. We had more than 300 people sign up to be in attendance at this, which speaks to how important this issue is. Please sign up at Facebook or LinkedIn to continue to get information from Children's Alliance. We'll add the links from people who were in the chat as well. We're also at children'salliance.org. You will receive a link to this presentation and an evaluation survey. And please let us know how this went over for you and what other issues you would like us to focus on in the future. We'd like to thank Catalyst Presents, our AV partner for this event. And thank you all. Thanks everybody that is in earshot of this call for participating and learning about this critical issue. Have a great day today, and we'll see you soon.